If you take heartburn medication like Nexium or Prilosec, federal health regulators warn it could be taking a toll on your bones. Our Courtney Lane met with doctors to explain this correlation and to see what healthier treatments they recommend.
Pharmacist Jeff A. Belt says stomach acid drugs like Prevacid and Prilosec have become more popular.
It allows us to kind of eat what we want to eat.
They're also now readily available.
Especially now that they're over the counter. I feel like that's probably the reason this has come out.
He's referring to new FDA-mandated warning labels, advising users take these heartburn drugs no longer than 14 days. The FDA bases this on 6 studies that show a greater risk for bone fractures, especially if you've taken the drugs for several years.
People need to talk to their doctor if they're taking it more than 14 days. If you're having more problems with acid or reflux, then you might have an ulcer or some other kind of problem that needs to be evaluated by your physician.
Dr. Brian Lowry says cutting back on these is especially important for those over 50, since the risk of brittle bones is higher.
I think it's always been a theoretical risk because of calcium absorption with decreasing levels of acid in our system.
If you have acid reflux problems and want to wean yourself off these medications, Dr. Lowry suggests first exercising to shed pounds and cut down on certain triggers like caffeine, alcohol, and spicy foods. He says the cheapest treatment is simply elevating your head at night.
You can raise your bed by just 2 inches, makes a difference. Put blocks underneath your bed.
And if they work for you, he says substituting histamine blockers like Zantac and Pepcid are safer. Courtney Lane, KLTV 7 News.
A Canadian study found the risk of hip fracture was nearly 5 times higher than those who took the pills 7 years or more. On the flip side, Dr. Lowry says they are revolutionary, reducing the number of ulcers and esophageal cancer.